So I think I stand between you and a break. Just bear with me for just a little bit. It's also a pleasure to be talking with you today. I have the privilege of representing the Society of Pediatric Psychology and the Society of Child and Family Policy and Practice on the forum, but today I'm actually wearing a slightly different hat. For many years of my career, I actually was fully co-located in the hematology oncology department, working with kids with sickle cell disease and cancer, and also became director of training in psychology, so also was simultaneously working in behavioral health and training psychology students and interns and postdocs. So I'm wearing a slightly different hat than I usually wear at the forum, but it's a privilege to be revisiting some of this. I want to present to you on something that our Table 4 has been really focused on today, and that is children with chronic illness and disability. So if we loosely define chronic illness, as many as 15% of children are affected, and prevalence appears to be rising. These are just some of the most common examples of chronic medical conditions. I want to remind us all, we've heard about this a little bit before in prior workshops, and we heard about it this morning from our opening keynote panel, which was amazing. The chronic illness and medical treatments pose repeated and sometimes traumatic stress. We've heard about medical traumatic stress before. They also pose interruptions to healthy development. Some conditions and or treatments are associated also with cognitive impairments, and we're crossing over here a little bit between behavioral health and cognitive functioning, because many of these cognitive impairments are in the area of executive functioning and self-regulation. Psychological distress can and does impact health. And there are very rich opportunities here for promoting behavioral health and preventing conditions. So there's basically a continuum of interventions working with chronically ill children and families. For all children and families, there's education. We heard about that this morning. Environmental intervention, and one of the examples here is, when we opened our bone marrow transplant unit at Children's National Health System when I was there, we had all the children had a whiteboard in their room, and we put them on a daily schedule to more mimic what their lives might be like outside of the hospital. Screening, and we've heard about that already today too, screening for both developmental issues and behavioral health conditions, and parent support. So that's something that all families facing chronic illness should receive. For children who are at particular risk, we should be offering, and we do offer, training and coping strategies. We heard about that today, especially for pain, cognitive testing and school consultations. Assistance with medical procedures, that's where a lot of the trauma comes from. So assistance in helping kids with medical procedures and adherence to medication regimens. Now that's where some of the health comes from. That's where some of the healthy outcomes come from, are adhering to medication regimens. And then lastly on this continuum, for children with identified problems, there's diagnosis, there's psychological and pharmacological interventions. So just to look a little bit at the training landscape, and I'm coming from the perspective of a pediatric psychologist. There's an estimated 65 internship programs in pediatric psychology in the United States, all of which have some level of interdisciplinary team training with chronically ill children and their families. That's where pediatric psychology was born. There are also a number of postdoctoral fellowships that offer specialization with these children and families. There's basically two primary models for training. One of them is consultation liaison, with psychology and psychiatry side by side. One example there is Mattel Children's Hospital in UCLA. Or co-location, and that is having a psychology trainee immersed in a medical department, in a medical specialty department. And two examples here are Children's National Health System and Nationwide.